Like that. Just like that. How's it going, everybody? I'm Dr. John Clayton. I am a specialist chiropractor here in Utah. My office is Supra Chiropractic. And a lot of people may ask, what is a specialist when it comes to chiropractic? Does that term really apply? Aren't all chiropractors the same? What does that mean? And so one of the biggest things in doing what I do, in educating people, in doing YouTube videos, is to show what it is that I do. And hopefully, in a lot of ways, it brings people to the light of, wow, this is different. This is something that I don't see when it comes to chiropractic. And that is the point. That is why I show what I do. But also, I always tell people I don't have anything to hide when it comes to what it is that I do for patients and what it is that I treat or address as a specialist chiropractor. And so one of the biggest differentiating factors when it comes to specialty chiropractors, I would say, is what area do they treat or work on? And the area that I work on is everything outside of the spine, but also including the spine. And so you name it, I do it. Jaw issues, skull issues, I work with sinus issues, I work with the rib cage, I work with the shoulders, elbows, hands, wrist, pelvis, knees, feet. Like I said, you name it, if it's in the body and it's in a musculoskeletal nervous system area, that is what I work on. And so many of the issues that get brought to my office or that get referred in are not something that you would just send to a normal chiropractor. And a lot of times if you do send someone in one of these situations to a normal chiropractor, they just kind of get through the rigmarole of, hey, come back 3 times a week for the next 6 weeks, and I hope that I can get you better. And so that's what we want to educate people on. That's why I educate people, is because I don't want people that have these legitimate concerns to just walk into any chiropractor and after seeing these videos that I make and say, well, I saw this other chiropractor fix this, so do that. They're not going to do that. And so when it comes to these videos, it's showing what I do, and unfortunately, not a lot of chiropractors do this. And so one of the biggest things, and you'll hear this in this video, is that the patient has said, I've never had any of this done before. I've never had these areas adjusted before. What's the deal with that? And unfortunately, most chiropractors just do the same thing. And so hopefully we start seeing more of a rise in specialty chiropractors, ones that want to do more than just your average chiropractor of slam, bam, crack the neck, crack the back, see you later. Those days are going to be short-lived because a lot of people don't like going to chiropractors that do this. And so before we get into the video showing the adjustments, let's talk about what I was working on and why the patient that I saw today in this video came to see me. And so I know the patient very well in this video. She's a good friend of mine. And the cool thing was that she had first reached out to my wife and said, hey, I'm having numbness in both my hands, but more so one hand, but both hands are going numb and I don't know what's going on. And there wasn't any, major history that made them think, oh, it's because I got in a car accident or anything like that. No, there was none of that. And so to a lot of people, that is a scary thing when someone at such a young age has an issue or symptom like that, and they will look for anyone to help them. And so the sad reality of these situations for most patients is that they will go and look for a chiropractor, and they'll go walk into their office and they'll say, oh my gosh, this is really scary. I'm really nervous. My hands are going numb. And unfortunately, the fear is already there. And so a chiropractor, or any doctor for that reason, not just chiropractors, but it's unfortunate that in those situations when someone already has fear that they are going to have numb hands for the rest of their life, a lot of times I find that they get taken advantage of in the fact of, oh my gosh, well, this is really bad. That means we need to do 1,000 neck adjustments for the next 10 years. And that patient will go, okay, whatever you say, you're the doctor. And again, that's what needs to stop, is that people that aren't given more information, or in some cases, they're led to believe, or basically they're instilled fear upon that if they don't get treatment from that location, business, doctor, that it will always be this way, or it'll only get worse unless you do what I tell you to do and be in my office. And so those are the most frustrating cases that I see, is when I can have someone that's gone through multiple chiropractic sessions, treatments, care plans, and we can work on them in one visit and get more relief or more done in one visit than they did over years at other offices. And so in reality, the reason why I claim to be a specialist and why I support those claims of being a specialist is by showing videos like this and saying, this is what I worked on, this is what I adjusted. And also we went through and we used acupuncture needles to perform dry needling on this patient to not only solidify what I did in adjusting. The adjustment in and of itself most likely could just fix this issue, but we want to take it one step further to really show patients, no, I want to get you better, and if I don't see you for a year because your hands are not numb, I succeeded. I did my job, and that's the way it should be. And so that's what specialist or specialty chiropractic means in my eyes. It may not mean the same for you, especially if you're a chiropractor watching this. You probably will disagree, but in the end, you can see the results for themselves. The results, the reputation, everything that I've seen, it's there. And I wouldn't want to do it any other way. And so when it comes to showing what we did for this patient in this video, I hope you guys enjoy this video. And if you've watched this far so far for this explanation, then please subscribe to this channel and like this video. And if you have any questions, leave them in the comments below so we can get to those questions and answer anything that you have. And I hope you guys enjoy this video where we show adjusting and doing dry needling for someone who has numb hands and how we can resolve that in as little as one visit. So what we're going to go through is the shoulder posture. A lot of people have their shoulders that roll forward like this, and so the big issue with this is that the neck would get this kind of hump right here. And so people all the time complain about neck pain, upper back pain, and we get this hunchback area right here, and we want to avoid that. And so the simple method that I like to show patients, and we'll show it from this back side here as well, is that we want to do, we call it the guns in the holster position. And so what this looks like from the side view, like if we see the shoulders here and we look at the straight up and down posture of the patient, we can see the ear hole here compared to the middle of the shoulder here. And if they're not lined up, then we know that we have a slouching posture. And so what we're going to do here is have the patient take their shoulder blades here in the back. We're going to do the guns in the holster, so we're going to bring them up, together, and down. Okay, and then hold that position. They're going to feel a lot of tightness in here from those traps muscles, right? The trapezius muscle through here, it goes all the way down through here and then hooks up into the skull. And what it's going to do, or how to check and make sure you're doing this right, they should be maintaining pressure through here or tension. And so if the patient then looks down, right, they should be restricted in achieving that, because these muscles are doing their job to maintain that neck posture, but also the shoulder posture. Okay? Okay, so now we're going to show it from this side here, and so now you can get a visual of what it looks like to do that guns in the holster position and then lock it into place. So we're going to go up, together, lock it in place. Okay, and then let it go to the sides. Just going to go boom, fall out. Okay, and then start again. So up, together, and then down. Okay, and then there should be tension felt all through here especially when you go to try and look down, it restricts you from doing that. Perfect.
So who adjusts you? Do you ever need to be adjusted?
Bracken.
Oh, nice.
So, but again, it's like he's so busy, I'm busy. It's like, when do you have time, right?
Right.
So, but yeah, I just need to clone myself.
I'm trying.
And then adjust myself. So, or teach my assistant how to do it, right? She probably could. She's smart. So.
Oh, really? That'd be sweet.
Or you can do it. There you go.
Just make Abby.
Just jump on my back and that'll be good.
That's what I try to do to Sean sometimes.
Just jump on it. Nice and hard. You ready for lots of pops?
Yep.
Let's do it. So I'm gonna do ribs first. Okay, so I kind of lift up on your hip here, and then I twist like that. Okay, you'll breathe in, you'll breathe out. I'll adjust as you're breathing out. Okay, so breathe in, breathe out, let it go. Breathe in, breathe out, let it go. Breathe in, breathe out. Breathe in, breathe out. Why are you so tight, man?
I don't know.
Jeez Louise. Slide down.
Yeah, it's horrible.
Slide down just a little bit down there.
I'm very tight.
It's all good. Deep breath in here. All the way out. Let that shoulder just relax. Nice. Perfect.
Very tight. Probably because I haven't been adjusting forever.
Yeah, we'll change that. We'll change that. At least you're here now. So
right.
that's all that matters. Deep breath in here. All the way out. 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 Very tight.
Yeah.
This one's always a little bit tender. This is kind of that junction between like your spine as it goes up like this and then dips down. Okay. Deep breath in. All the way out. Nice. Breath in here. There we go. It's like every other one is good, right? Okay. So then I'm going to go here on this shoulder, and then my hand's just going to be here on the head. I'm just going to kind of move it to the side like that, and then just kind of push through your shoulder like that. Okay. Deep breath in.
Oh,
Yeah.
nice.
And then here, all the way out.
Oh
My goodness, that's where you're holding all of it, man.
That's where I hold a lot of my pressure there.
And then here's those ribs right there. Okay, so I'm gonna do the side that has like the arm numbness first, and we'll do the side over here second. Okay, it's a little bit tender to adjust though. So I'm just gonna kind of hold. I gotta like lift this muscle up out of the way, get right on that rib, and then I'm gonna pull the head towards you here, and then push like that. Okay, so super easy, but not at the same time, right?
I bet.
Deep breath in, all the way out. Let it go there. Let it go. Let it go. Just like that.
Oh my gosh. That's crazy.
Didn't know that was a problem, did you?
No. Wow.
Same thing here. Go there.
Oh, wow.
Okay.
Holy crap. That's crazy.
We nailed it.
I've never been adjusted this way at all.
Yeah, well, I believe that too.
That's awesome.
Did you get a lot of tension through here at all? Or not too bad?
Sometimes. It's more just on my shoulders, my traps. My neck. I bet people that wear fake vanishes, that's
Yeah, it's, yeah, they're gone. They're gone after that. Then we're going to bring the bottom arm all the way through. Okay, and then bring this arm here. Go across your abdomen. Hold that wrist. Okay. And then, let's see, scoot down just a little bit there.
this way or?
Yeah, that's perfect. So we're gonna work on this tension right here. So your back muscle, this lat, goes all the way down, hooks in right into your spine. Okay. So a lot of people that have this kind of like upper low back pain, it's usually because their lat is too tight. Okay. And so when we do this one here, I'm gonna go underneath your arm. Okay. And I'm gonna hold that wrist nice and tight, and then I'm going to have you headlock my arm, like try and break it like a headlock. Okay. And then take this just cheek here and slide it towards me. There you go. Get There's a lot of rotation in there.
Yeah.
Okay, and then headlock my arms as tight as you can. Okay, breathe in, breathe out, tight, 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 lock it in.
That was cool.
Just like that.
I love that one.
Crazy, huh?
That's awesome.
So we use your tension against you.
Yeah.
So now we can do your hip now.
Okay.
Right here, deep breath in, all the way out, let it go. Here. Oh! Just like that, the deep one. Okay, then lay on your other side.
Yeah, I always love the hip hop ones too.
Awesome. We're gonna check this tension here on this other side.
I can't remember, is it this?
Yeah, that's perfect. Yeah, we're gonna bring this guy down a little bit there. Hold there, lift this elbow up, sneak underneath there. Okay, bring this cheek towards me. Okay, then lock it in nice and tight. Okay, breathe in, breathe out. Tight, 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 lock it in. Yeah, buddy. You're good. Okay, then we're gonna go here, hold the shoulder. Deep breath in. Here. Not too bad. One more. Not too bad. Lay your back now. So now we're going to pull the hip. Okay? And it's just going to feel like a really fast pull. Okay?
Oh, I remember that one.
So. Okay, let it relax. Just like that. Okay, here. That go.
Nice.
Huge click in that one.
Is that in the knee or is that hip?
No, hip.
I couldn't really tell, I'm sorry.
I mean, you'll get
I
a
was
little
like,
bit of knee.
I felt like everything was just moving my body.
Well, did you have any knee injuries back in the day?
Yeah, I had the ACL.
Oh, ACL one? Okay.
Yeah.
Perfect. Okay, so feet, the ankle one just feels like another pull. Okay. And so if you feel like you need to scoot yourself back up after,
Okay.
feel free to. Okay.
I feel very relaxed right now.
See, we're just getting warmed up. Okay. So, I feel the ankle here. Okay, you're gonna get a nice little pull here. Let it go. Let it go. Down like that.
Yeah, I felt that one.
Let's slide up a bit there. Okay, so then we're going to roll across these guys. So when you get a lot of tension in the underside of your foot here, right, kind of that, a lot of people are like, oh, it's plantar fasciitis. Kind of, a little bit, right? So I'm going to grab here, roll it across, sit down like that.
Nice.
Okay,
I like that.
this one here, across, a little tender, not too bad. And then the toes, not too bad.
Nice. Nice.
3 for 5. Okay, then other ankle here, let it go, let it go. Solid. Here.
I've never done these, everything. It's always just the neck and back for me and hips.
Yeah, I mean that's the standard.
Right.
That's the standard out there. So, do you feel like the knee still bothers you though after the ACL?
Yeah, it's here and there.
Where does it hurt in the knee?
I think it's on the outside left.
Like up here more?
Like right here.
Okay, okay. So with this area, from a muscular standpoint, there's a muscle that goes between this bone here, the shin bone, and then this bone out here. Okay, so tibia, fibula. Okay, there's a muscle right here called the anterior tibialis. Its job is to elevate your foot, and then kind of go out with your toe like this. Okay, kind of point your big toe away, like that. Okay, so you can see that flexing here.
Yes.
Okay, so a lot of times, what people end up doing is the opposite of the job of that muscle. They cross their ankles.
I do cross.
Okay, and so I always tell people, it's a dumb little trick, but please avoid that as much as you can. Okay, and so because mainly for the fact of how much it hurts to manually release that. Okay, so if we take kind of the broad side of the elbow forearm area here, and I just lay that into this area of the anterior tibialis, right there.
Yeah.
Sucks. Not too bad?
Not too bad.
Okay. I'm only on one part of it. Then I work up higher. Still not bad? Good.
Oh, yeah.
Not too bad?
Yeah, a little more.
Okay. Are you just so relaxed that you don't feel pain right now? What is
I'm
this?
so prone to being in pain that I just,
Yeah, I got you. So then what we want to check, that's also here up here, from the bone perspective is rotation in the kneecap. Okay, or sorry, like the knee area here. As long as the cap looks straight on here, we're gonna feel the two bones below that. Okay, this bone's very prominent, this one's not, and so what it's doing is that it's going like this. Okay, and so that way you always feel tension in that outer side here. So what we do is similar to the hip pull, but then I use a little rotation to then bring this bone back like that. Okay. So we're gonna go here. When I do it, bring it around town. Okay. So bring it around town, then I pull with that rotation. Okay. It's just nice and fast. Okay. Here. Like that. Okay. So you can feel the difference. That was knee versus hip.
Yeah.
Okay.
Right. That's what I did on that one.
Any issues with this one?
I don't think so.
Nothing too much. We'll check it and see. It's no, it's pretty straight. It's pretty straight. Okay. So and then the big thing is over dominance of quad muscles. These guys here versus hamstrings. That's the primary issue.
I have a lot of. I don't have hamstrings. I got quads.
Yeah. Reverse that. Okay. So.
That's a problem.
So now we're gonna do arms. Okay. Let that relax there. Go to the side here. Okay.
Oh my god.
How's that?
That's crazy. John, that's crazy. Oh my gosh. I've never done that before.
Didn't think you had that one.
No. Oh my gosh.
And then so that's one part of the elbow here. That's what make these guys go numb. These two. Okay. And then these three can go numb from this one here. Okay. If they all go numb from the wrist, it's carpal tunnel. Okay, this not carpal tunnel syndrome, but like the carpal tunnel area, right? So this one here, we go in towards your side like that. Okay, so let it go. Not bad. Okay, we're gonna run through where the two bones kind of cross over each other, break up any scar tissue in there. Okay, wrist we're just gonna kind of pull and wiggle now, like that. Not bad, right? Fingers. Gotta get them. There.
Now my arm's dead.
Professionally beat up. Gonna go here. Just like that. This one in like that. Not too bad. Clear this out. Sorry.
Wow.
Oh, feel how tight those bad boys are. You probably need to needle that arm. Jeez, man. Okay.
That's the side I hold family a lot.
Probably. Juicy thumb on that one, man.
That's the thumb one that's been having the problem, so kind of feels nice.
Do you not normally like pop it yourself at all?
I used to pop it back in the day, but I haven't in probably less than 20 years. It's been a long time since I popped my.
Holy cow.
Yeah.
You're welcome.
Thank you. Thank you for all of it.
Yeah, absolutely. So feel that notch right there?
Yeah.
Yep.
Oh my
so
gosh.
There's that adductor pollicis muscle. Okay. So like I said, if you can feel like a literal knot in such a weird muscle there, it's like let's just needle that puppy.
Wow.
Okay.
That's crazy. So. I got hit in the jaw, and ever since then, like if I lay on or put pressure on like headphones or anything, my ear burns up.
Interesting.
So it's happened for almost 12 years now, and it's weird because once in a while it will go away, and then it'll come right back. So I don't know if it has to do now with like when I like pressure, like if I where I hold all my stress and stuff, but
okay. Could be.
Like I went to an ear doctor and everything, and they couldn't figure out what's wrong.
Gotcha. Because they would come from the nerve that's right back here.
Right, that's what I thought, right.
So.
And then I got hit in the jaw about a month ago in a soccer ball again on this side.
Okay. Double whammy, huh?
Yeah, so I'm like, whatever.
That's all good.
The body's just getting screwed up.
It's all good, man. Okay, so we're gonna go through here. So a lot of tightness up in there too. So upper neck. I wonder too if it's coming from your skull potentially. We'll check it and see. Okay. It's right over here to the side. Relax there. Should work up here. A little high. Go there. A little guy up there. A little bit of skull stuff here.
What does that mean? Just
The skull can get misaligned.
like just on the axle part or the?
Yeah, where it meets up with the neck. So this little microphone here. Tape it on right there. Okay, so a little bit here. I'll lift the head up here. Get my arm underneath here. Come to the brace here. Okay, and then my arm's just gonna be right here, but my arm will be next to your shoulder and chest. Is that okay? Okay, deep breath in. All the way out. Let it drop in.
Dang.
A little crazy there. It's one of those headers in soccer.
Yeah. That's right.
Let's slide down just a little bit from there. Okay, so now with jaw, this table that I have, it pops. It makes a loud sound because it drops. Pops, locks, and drops.
Nice.
Like that. Okay.
Nice.
So what I'm going to do is use that table to help me to adjust your jaw without you feeling like I'm fully punching you in the face.
Okay.
It still feels like I'm punching you in the face though.
That sounds like fun.
Okay, so it's kind of loud.
Hopefully I don't have a reaction.
Yeah. I'll dodge it. I'll dodge it. So here it drops down like that.
Okay.
When I do the jaw, your head is turned to a side, and so I'll kind of cover your ear so that way it doesn't sound as loud.
Okay.
Okay. So here, okay, open about halfway, a little bit more. Okay, and then open all the way and close. And then open halfway again, hold in that position there. Now turn, clear this side. Let it just drop in there. And drop in there.
Wow.
Yeah. Okay. Here's the big one though. Okay. This is the bad side. So now you're going to open about 3/4 of the way. And get right there. Okay. Try not to tense up too much there. Let it drop in there. Let it drop in. Let it go. Let it go.
Oh, dang.
Feel that thing pop back in there?
That's cool.
Crazy, huh?
I just want to know who was the first person to figure that out.
Probably someone who got punched in the face.
Let's just try to just...
We'll just slam it back in. Okay. So that shit, you should start feeling that kind of dissipate. Okay. The tension in there.
Yeah.
Okay. Still a little bit of muscle tension here, but like
yeah.
that side feels like money right
right
there.
I can feel it.
Any questions on any of that?
Oh, that was wonderful.
The dry needling for numbness in the right arm into the hand. So we've needled, we have the left trap there. We typically do have one down there in the thumb there. And then we've got left trap. See that twitching there. We've got the right trap here. Right infraspinatus. The lat tied to the deltoid insertion. The lower forearm, kind of by the brachialis area, into the middle area of the forearm for the extensor muscles. All right, so I hope you guys enjoyed the video. And one of the things I just wanted to kind of recap on or kind of go into more detail about is that within the claim of saying, okay, I'm a specialist chiropractor and I saw a patient today with, numb hands, and yes, I did more than just adjust her neck and send her on her way. And is that different from most chiropractors? Probably. And the point of this is that there's so many other things that are out there when it comes to chiropractic or these ways of treating patients and helping them. And I think one of the biggest things is making sure that you go to the right, doctor for whatever this is. And that's why I like to show these videos, and why I love making them, is to educate people out there in the public to say, this is what I do. This is what I work on, and I've seen that in my day-to-day life. And with this patient in particular, my wife was the one who had the conversation with her to say, yeah, I think that's what my husband does. That's what Dr. Clayton does. And so that's how this whole entire video was brought to be, was a simple conversation from my wife to her friend. And so in the end, that's a lot of where I receive referrals from, is from patients that say, no, go see this guy. Go see Dr. Clayton at Supra Chiropractic. That's who you want to go to. And in the end, sometimes there's cases where I may not work on that particular issue. And in that way, I have no problem referring out. And I think that's a big problem in chiropractic nowadays. And a lot of people tend to find that they'll walk into a chiropractor, and let's say they have numbness in their hands and the patient's not getting better. Do we, as chiropractors, look at that and say, oh, we'll just keep treating and hopefully it gets better? Or do you then take the opportunity to say, well, then maybe you go see my friend or this other chiropractor and see what they can do for you? And in a lot of ways, it's unfortunate, but that doesn't happen nowadays. And that's what's so frustrating, is that many people are brought to believe that chiropractic doesn't work. And I think in a lot of ways it's because the chiropractors all do so much different stuff. We don't really know what everyone does. And I would encourage every chiropractor to put on their website or make videos like this that showcase what they do and what they're good at, because I think everyone's good at something and we can all help and get people better, but we need to put ourselves out there. And so in a lot of cases, specifically, let's say car accident cases, I end up teaming up with sometimes multiple chiropractors, physical therapists, massage therapists, doctors, you name it. We work as a team. And to me, that's what it should be like, is that if there is a particular issue that a patient is struggling with, if it's outside of my scope of practice, something that I cannot work on, treat, see a patient for, technically, then I refer out. And that's the way it should be. And you should be able to trust other people in your community and also have them trust you, so that they also will send referrals your way, because they know that you'll help the people that they care about as well. And so that's one of the biggest things, is next time you're at a chiropractor and you're not getting better and you would like to know if there's any other chiropractors or doctors or anyone else that can help with whatever you're going through, whether it's neck pain, back pain, foot pain, whatever it is, right? Ask that doctor and say, well, if I'm not getting better, who do you recommend that I go see? And see if they say another chiropractor. I doubt that it would happen. And that's unfortunate, because in the end, you end up most likely having to find a chiropractor for yourself, because that chiropractor wouldn't want to lose business, and they want to lead you on to believe that you need to stay with them, and that if you no longer treat with them, then you have done something wrong. And a lot of times they make you feel that way. And to me, that's not right. And so if you've experienced this, I'm really sorry that that's happened to you. And that doesn't happen at my office. There's enough people out there that need what I do, need what other chiropractors do too. And so I'm happy to refer out. I'm happy to send business other ways, because in the end, it always comes back to benefit me, mainly, not necessarily in a monetary way, but to know that that patient was taken care of. That builds so much credibility for me, because that doctor, or that doctor that treated the patient, can actually help that patient where I couldn't. but also the patient holds me at the highest standard possible to what I claim. Specialty chiropractic, right? Specialist. Because I knew when to refer out. And I think that's one of the biggest differentiating factors as to make me what I claim. Not only in what I show, what I adjust, what I go over with patients, how I educate my patients, but also in that I know where my scope of practice is and I know when to refer out. And so I hope that this is beneficial to you to know more about this, to learn that there are different chiropractors out there. You just got to look and help find the right one for you, or if you're in Utah, get a hold of me, call my office. And if you're looking for a chiropractor, let's find you the right one. Let's get you to the right person and make sure they're going to treat you well and help you and want to listen to you and fix the issue. Because that's the way it should be. That's the way that chiropractic needs to move towards. And that's my spiel for today. So I hope you guys enjoyed this video. I hope you guys enjoyed the longer education moment that we were able to give you. And in the end, I will leave you like I leave you in every other video. We're at Supra Chiropractic. We've got your back and everything else. And I'll see you in the next video.